It's my pleasure to welcome all of you here with Dr. Roxana Chicas at Emory University. She's a postdoctoral fellow there and holds her PhD in nursing from the Emory Nell Hodgson Woodruff School of Nursing. I am Laura Barbas Rhoden, faculty member at Wofford College. I'm also a participant in a number of community efforts in Spartanburg, and I'm thrilled to see in our participant list students, faculty members, and community members from the Spartanburg area. Thanks also to our friends at USC Upstate for joining us. We're thrilled you could all be here today. I'm going to introduce you to Dr. Roxana Chicas. We'll do a quick film screening of a documentary featuring a project of which she was a part. And then we have a series of questions to be in dialogue with her to learn a little bit more about her work and the efforts around farm worker health of which she's been a part. So as I mentioned, Roxana is a nurse and a nurse scientist. She is working on research on environmental exposures and occupational health hazards among immigrant agricultural workers. And she aims to understand factors that contribute to occupation-induced health challenges, including heat stress, acute kidney injury, and she's also looking at interventions, ways to mitigate for the preservation of health and the enhancement of health of farm workers as they labor in the fields in the United States and elsewhere. Dr. Chicas' roots are in Central America, and she brings invaluable perspectives to a very critical justice issue that I know matters a lot to many of you who are joining us today, which is how to elevate farm worker health in conversations about food systems and farming, and especially as we think about those systems that are made increasingly vulnerable and people made increasingly vulnerable by climate change. So welcome, Dr. Chicas. Thank you so much for joining us today.
I'm happy to be here. Thank you for inviting me.
If you'll bear with me, I'm going to share my screen and we'll look at a documentary that I think will introduce you in a really compelling way to the work that Dr. Chicas has been a part of doing.
The projection that has Florida in the world is that it is Mickey Mouse, it is Miami Beach, it's all these beautiful people, but nobody sees the inside of Florida. Florida is the second largest producer of fruits and vegetables in the United States. And all that work, all that production and fruit and vegetables is being done by people from Central America and Mexico.
Hay que estar todo el tiempo agachado y es muy pesada también cargar un bote de 13 galones y con el peso del sol y se da cuenta.
The Hirosola Study is a study that we've been doing in Florida for the last 4 years. So we want to find out, how does working in the fields, being exposed to heat, how does that really affect a worker physiologically? And with these workers, we wanted to see, will they take a core temperature pill? And that will let us know what their temperature is throughout the whole workday. Will they wear equipment to show us their activity? Will they wear a heart rate monitor, like the ones that runners and athletes often wear? And will they come and see us and let us have their blood and urine samples so that we can really get a whole physiologic profile of what's going on in their bodies while they're at work? Because once we have that starting point, then we can know, well, what's our current state? And then where do we need to go to make sure that over time we're all adapting to heat and making sure that we keep our workers as healthy as possible.
Y es un estudio en el que estamos midiendo el efecto del calor en los trabajadores agrícolas, pero
most people in the United States don't know where their food comes from. They have no appreciation. It just drops into the grocery store and there it is. And I think that's what struck me, having done a lot of occupational health research, the fact that we could have this invisible workforce.
A lot of people don't realize that most vegetables, at least part of the whole crop, are hand-picked. Citrus is hand-picked. You know, strawberries are hand-picked. And they got to do it by the bucket, not the hour. So you'll see them in the fields running back and forth, physically, literally with a 40-pound bucket, running to the truck because they get paid by the bucket all day long in the heat and the rain and the mosquitoes. It doesn't matter what it is, but they do it by hand. There's a large section of the population here in the States that will not do that job for any amount of money. Name the price, you won't do it. You do one day and you would quit. We need them. We need to, you know, it's tough out there.
Mi nombre es Jesús. Vengo del estado de Tabasco, México. Llegué hace 17 años. Las personas que venimos, como ella, yo, los vecinos, X personas, vienen aquí a trabajar. Desde hace 2 años y medio aproximadamente, estábamos trabajando en una nursery. Realmente lo duro ahí, el calor agobiante que hay aquí. A veces la temperatura ambiente está favorable porque corre la brisa, nuestros cuerpos se refrescan un poco más, pero las condiciones de trabajo son verdaderamente, en el campo son verdaderamente duras.
Mire, estoy tomando mi tiempo para poder platicar con usted.
They come before work and they have a blood test done and a urinalysis done. And we also put equipment on them that measures their core body temperature and their physical activity and how hot the temperature is around them. And once they're done working, they come back to the office. And again, we do a urinalysis, blood test.
Over 75% of the workers would come to see us at their pre-work day visit already dehydrated. The key indicator that we were looking for in the study was core body temperature. The physiologic limit that we were using was 38.0 degrees Celsius. Over 80% of our workers that we studied on at least one study day exceeded that physiologic limit. That puts you at a Fahrenheit temperature of 100.4. This core body temperature rise, this fever, it puts stress on the body. So it's kind of like, well, what would it be like for you to have a fever every day of your life, you know, for some portion of the day? We found that in our sample, there's an association between heat, or heat index in this case, and acute kidney injury.
¿Qué son las enfermedades por calor? Bueno, nosotros pensamos que esta es una buena analogía de lo que es una enfermedad por calor. ¿Qué es lo que está pasando con ese carro? Ahí los hombres deben de decir, pues, ¿qué le pasó a ese carro? Se sobrecalentó, ¿verdad? Ese carro se sobrecalentó. Eso es lo que son las enfermedades por calor también. Nuestro cuerpo se sobrecalentó.
I've been working for the Farmworkers Association of Florida for 13 years. We are doing the trainings in the same communities where we collect the data. So even many of the participants of these trainings are participants of our research. So it's a reflection of their own reality. I think that bringing that into the training really make an impact.
Preguntó dónde está el agua y le dijeron, ahí está el agua, me siento mal, ve a tomar agua. Lo mandaron a tomar agua y el señor se pasó de donde estaba el agua y ya después lo encontraron muerto adelante de donde estaba el agua. Pero cuando no le pagan por hora, pues uno tiene que ir a la carrera, toma menos agua. Cuando uno va más a prisa, también genera calor. Entonces, por eso son muchas cosas lo que hace que los trabajadores agrícolas sean 20 veces más en peligro de fallecer por calor que los trabajadores de otras industrias. Que las enfermedades por calor se pueden prevenir. No tiene por qué las personas morir. Está en sus propias manos el decir, voy a parar y no voy a seguir.
I do not think anybody should have to worry about their work and being safe at work and getting sick because of their work. So I think that with heat, there's a lot more potential to work with employers to make their workforce safe.
You are a nursery grower producing plants. Are your workers considered farm workers or not? Yes, they are.
We don't have that in mind when they say you need to rest. Maybe your workers need to take some breaks or they need to hybrid. But now we have the data to actually prove why is that important.
I believe like a lot of the challenges that come to them is not because they don't want to implement all these safety guidelines, but it's because they are not aware of the risks they involve.
Where the work has gone is we started off with surveys and then we started to do comprehensive heat biomonitoring. So we'd actually be able to see what's going on physiologically with the workers so that from there we can plan some sustainable interventions for heat. Because as we know, it's not going to be going away and we just have to figure out the way to keep everyone healthy and productive in the meantime. So that's what the work's about.
You're benefiting everyone. You're benefiting the employee that's receiving this training. You're benefiting the manager that is understanding how to provide the best safety guidelines for the employee. You're benefiting also the company that is increasing in production. You're benefiting local and regional industry and economy as well.
The Farm Worker Association has in the past been successful at bringing employers to the table. And especially with the Ag Center, we hope that we can get more employers at the table to work on practices that lead to a healthier and more productive workforce.
Where we could start is just making sure that we have certain resources at the sites. Cool, fresh water to drink, bathrooms that are comfortable and clean for workers, and also places that are in the shade where workers can take breaks that aren't so far from the work site that they couldn't use them regularly.
I think as a society, we need to believe in a culture of health for everybody, that health is a right that we all have, independent of your class status, independent of your legal status.
As a nurse scientist, I want to make sure that the research that we do is meaningful, because research by itself is just some data. If people don't get the message about the work, then nothing's going to happen from it.
Ellos sufren demasiado calor, más calor que nosotros, porque ellos están en la viva tierra, que está calientísima, y agachándose demasiado, de veras. Para ellos que cultivan las frutas, que yo también compro, les agradezco.
Que en los jardines que tienen ellos pues, son de estas manos que salen. Debe de haber para las personas que trabajan en el campo un poquito más de sensibilidad, un poquito más de respeto.
That's a really beautiful video, and really appreciate the interviews and the voices from researchers and from the workers and organizers in those spaces. And I'm wondering if you might share a little bit more about your introduction to nursing. I think we see you in a really compelling kind of research. And I'm wondering if you could share with us a little bit more about what led you into nursing, and then what led you to the really hard work of pursuing the work of becoming a nurse scientist as a doctoral student and a postdoc.
Yeah, so I'm from El Salvador. I came to the United States when I was 4 years old with my mom, very much like you may have seen on TV, through the southern border. And so I lived undocumented here in the United States for 14 years. And when I was 18 years old, I was granted TPS, which is temporary protected status, because I'm from El Salvador. And I worked at a pediatrician's office who also had nephrology patients and pediatric nephrology patients, and they had several Spanish-speaking patients. And I became like the unofficial interpreter. But I had been interpreting basically all of my life for my my parents, for my family, other family members and communities. So I understood, I had a bit of an understanding of medicine. And while working at the pediatric nephrologist's office, I started to like interacting with the patients, but I also became frustrated because I felt like I couldn't really advocate for them because I really didn't understand, the pathophysiology and like all of these other things that you need to be able to advocate for them to get certain procedures and medications, and also for me to be able to explain things to the parents. And, I also, watching my mom work and other family members work in industries that don't have very many labor protections was also influential. And so I actually, in the beginning, I wanted to be a medical assistant. And one of the doctors where I worked at, in between patients, stopped me and said, "Roxana, I hear you want to be a medical assistant." And I was like, "Yeah," because I was like super excited, right? I was like 27 years old, 26, 27 years old. And he said, "Well, why would you do that when you could be a nurse?" And I had never thought that I could be a nurse or a professional. I always saw myself as like an assistant, like a medical assistant. And I said, well, nurses are like really, really smart. And he said, yes, because they go to school and they study. And I asked him, "Do you really think that I could be a nurse?" And he said, yes. And so that just like blew my mind. And he said, just go to Georgia Perimeter College, which was a community college that was, down the road. And that's the only place that I applied to because I didn't know that you could apply to several different places. So I went to the community college and got into the nursing school. And my first, my goal was to be a charge nurse because I had this very, very narrow view of what nurses did. I thought nurses were only like in the hospital at the bedside. So I wanted to be a charge nurse. And in my first semester in nursing school, Emory University came to visit our class to talk about a program that they were launching with the community college about getting more minority nurses into get graduate degrees and get a bachelor's degree, and preparing them to be competitive to get into a PhD program. And that it was going to be a program to immerse you into research. I had no idea what that was. I didn't even know that there was a PhD in nursing. It was like way beyond anything that I had ever thought about. So I took the flyer to the same doctor who told me I could be a nurse, and I showed it to him and said, look at this. There's this program. Do you think that I should apply to it? It's okay if you don't think I can do it. And he was like, well, if not you, then who? And so I applied, and at Emory, I got to be around several researchers, and I learned that with research, it takes a long time, but research can have broad impacts on populations. Whereas as a nurse, your impact is like with that patient at that moment at the bedside. And I thought like this is kind of cool to be able to really impact an entire population, which I'm interested in the Hispanic population. And I honestly didn't know what area of research I wanted to do. I just knew I wanted to do research with Hispanic population. And so I was told that I should apply to, once I got my associate's degree, I went to Emory because a mentor at Emory told me I should go to Emory to get my bachelor's. So again, I only applied there and got in. And while I was finishing up my bachelor's, I was told you should really apply to the PhD program. And again, I did that and I got in. But I was asked, who do you want to work with? Which kind of blew my mind because I felt like I'm a student. What do you mean, who do I want to work with? Shouldn't it be like, who wants to work with me? And so I knew that Linda McCauley the dean of the School of Nursing did work with agricultural workers, but still then I could not imagine even saying, you know, I would like to work with her. So I just said, I just want to work with whoever wants to work with me. And it just so happened that I got to work with the dean, Linda McCauley, to do work with agricultural workers. And my parents are were agricultural workers in El Salvador, not here in the United States, but I had heard already many stories about how difficult life is for agricultural workers. And, you know, I thought that my mom's life was difficult working here. And I just felt that as a nurse, as formerly undocumented immigrant, that it was important that I started to be a part of a team that was doing research with agricultural workers so that I could give back to my community. So that's what really led me. You know, it almost picked me than me picking it. Like I kind of felt like it was the right path for me.
That's fantastic. It certainly sounds like the right path as you describe it, and one that's been incredibly rewarding, not just to you, but also that you find a lot of joy in those interactions with people, but also imagining the impact that comes from the research and that sort of laborious data gathering that we saw in the video. I'm wondering, you know, as we think about being in a pandemic, as we think about you know, the tropical season being so active this year and wildfires in the West, all of those things have an impact on farm workers and communities. I wonder if you could talk a little bit about what you see affecting farm worker health right now and in the moments when you've been in the field working on projects.
Yeah, so, you know, for our research, it's very important for us that we give back to the community, like in the moment when we do research. It's not just go do data collection, take it with you, and that's it. We actually, you know, being a nurse is really valuable because we take their blood and urine, and then we give them the results at the end of the day. So I get to give them their results, explain what they mean, health education, explain the difference between, you know, a glucose level and an A1C that measures three months of your glucose levels. And they often ask me lots of questions that perhaps they've said to me that they don't feel comfortable asking, like if they go to a clinic, because they feel rushed. So that's very important. And oftentimes we have been like the only type of healthcare that they have received being in this country. So getting like, you know, a mini screening of them. Like they're so grateful just to know like, oh, their blood pressure is fine. Or if we find something that we tell them, and the Farmworkers Association of Florida is able to find resources in the community to try to get them the treatment that they may need. So COVID is, as you all probably already know, is ravaging communities of color. Hispanics are 2.8 times more likely to get COVID, more than 4 times likely to be hospitalized. And so we don't really know how COVID is impacting the agricultural community by statistics, because we don't collect, or at least it hasn't been published, occupation of the people who are getting infected. But based on media reports, we estimate that at least 6,000 cases have happened of COVID within agricultural communities. And it's very difficult for agricultural workers right now, because, you know, the restaurant industry was one of the main buyers of food. And so that has gone down. So although agricultural workers are still working, their hours have decreased, their days have decreased, their wages have decreased. And for a community that already has low wages, it's it's putting a strain. I was there in August and in June, and it just blew my mind to see that agricultural workers are having to line up to do to go get food from a food drive. Like, that should not be happening. And so half of the agricultural workforce is undocumented. And so they have no, unemployment, they can't apply for unemployment benefits. They don't have, all agricultural workers pretty much don't have paid sick leave. And so many of them don't want to get tested because getting a positive means they won't be able to go to work. Some may even get fired. In many of the workers that I spoke to said that their employers, for 1 or 3 days would check their temperature in the morning, and then that was it. Then they were like, you can self-monitor yourself. They're not getting even basic testing, access to testing, which I think that if the US government categorizes you as an essential worker critical to the infrastructure, then they should be getting access to testing all the time, because in their jobs, they can't spread out. They move in lines together. It's very difficult to social distance. Many of them are not being provided masks to wear. And like in California, there's the fires that are happening. And there's been several pictures put out where the workers are working and all you see is a cloud of orange and yellow smoke. And so in those conditions, employers are supposed to provide them N95 masks to protect them. And many workers are not being provided N95 masks. Now, granted, we do have a shortage of masks, but again, when employers aren't even making the effort yet, or farm workers organizations are able to provide those masks, I think is telling. I saw in the news, like for example, some airports are now offering COVID-19 tests to their customers. Why can't the agricultural industry come together and provide testing to their workers? It just blows my mind. And so, in addition, some of these workers, like H-2A workers, and but all agricultural workers, many of them live like in substandard housing because their wages are so low, crowded conditions, multi-generational families. So, we've seen on TV where like celebrities or news anchors are quarantining in their basement while their family lives upstairs. Like, that cannot happen in an agricultural family. It's impossible to self-quarantine. And so, and the floods, the hurricanes that are coming have also been devastating to the agricultural community because it destroys crops. And so it, again, affects their wages, and their substandard housings, get flooded, and they don't get the same safety resources that, that Americans get, because they're undocumented. And even if they are documented, there's like these barriers that they don't understand how to get access to those resources. So it's quite alarming to see that, a workforce that is so vital to our, existence is so marginalized and doesn't have basic protections in place. And they're also constantly exposed to pesticides, chronic low dose pesticides. And we know that pesticides have, we see more congenital malformalities, so birth defects. And we also think that pesticides are contributing to higher rates of obesity, diabetes, high blood pressure. So, and they get no protections.
Yeah, what you're describing, in addition to that exposure to heat and those long working hours in hot conditions, what you're describing is, so demanding in terms of physical health and also mental health. And I think that's a question I'll interrupt with from our Q&A, just to break in and ask about work conditions and the lack of access to healthcare and what effect that might have on mental health and well-being, sort of emotional well-being.
I have. My daughter just came from gymnastics.
Fantastic. That's awesome.
I wanted to say also about this heat, you know, outside workers do not have heat protection standards. So they don't have like, you know, required rest breaks and shade and water. And that is really, is a huge driver to why we see that agricultural workers, in the video it said 20 times, but there's a new statistic that was published that says it's actually 35 times more likely to die from a heat-related death. And so I think that when it's so high like that, you would think it'd be common sense to have some kind of heat protection standards in place.
Yeah, no, that is an incredible statistic to think of that much more likelihood of death from something that can be mitigated and in fact prevented. Yeah, that's incredible. I wonder if you could talk a little bit about you've alluded to those barriers and systemic exclusions, but could you talk a little bit more about some of the structures that help explain the realities you described? You mentioned that one, that they're not standards for outdoor workers. What are some of those other barriers or structures that influence what we're seeing now?
Yeah, there's this thing called agricultural exceptionalism doctrine, which started, we're back like in the 1930s, where a series of laws were put into place, like the Fair Labor Standard Act. And so in those laws, what happened was there was a negotiation that happened with FDR in the South. So FDR needed the South to sign on to what he was to this law. And so what he negotiated with the South was, okay, the South didn't want these things to be enforced with agricultural workers, because they said, you know, this is very much subsistence farming. It's us families. We don't need to have all of these regulations in place. And so what that, as a result of that, agricultural workers there is no minimum wage for agricultural workers. Overtime pay is not required. Half of the states don't even require workers' comp for agricultural workers. They don't get sick pay. They are not allowed to unionize. In California, they can, because California has state law where they can unionize, but in the rest of the states, they cannot. Layer on top of that, immigration and anti-immigration laws that are in place. So it's a series of policies that have been put in place that pushes agricultural workers to these very precarious conditions where they can't really speak up, right? Because they want to be good workers. They need to put food on their table. And policies aren't even in place where they could speak up to want something more, because they're exempt from it. So that, and then also, you know, OSHA does very little regulations on agricultural fields, because again, they're supposed to be families. And that narrative has continued until today, that where the agricultural industry has lots of lobbyists, lots of money being put in to make sure that these laws stay in place. Whereas agricultural workers do not have, you know, lobbyists lobbying for them. And so that continues, that same narrative continues. So the laws haven't kind of kept in place to what the reality is now. And I think also there's a lack of awareness by the general public on the plight of agricultural workers, which this is why I'm so happy that you invited me, because I think that if more people were aware of it, then it would cause outrage, and we would all collectively voice our opinion and try to get some legislation passed and force industry to, you know, be good to their workers.
Yeah, thank you for that. You know, as you name barrier after barrier, it really is incredible, the conditions that have been produced by powerful voices and by structures of power in our country around the food system, as well as, you know, the video began acknowledging how invisible that is to consumers. And I wanted to ask a question about what might also be less visible to many people, which is the sources of strength and resilience within those farm workers as individuals and the communities and families that they have. And I wonder if you could speak a little bit about what you've seen in terms of the way farm workers and their families, many of whom are all working together, what are the sort of wells of strength that they tap into as individuals and communities?
Yeah, so the community is very resilient, has lots of strength that they have built with time. I think perhaps one of their biggest strengths is having family and community, like the reliance on each other, on where, you know, if you feel sick, you tell this other person who kind of has some type of home remedies that can help you feel better, or, you know, when someone has a baby, the whole community kind of corrals around to try to help that mom with the new baby. I think that that's one of the big drivers is family and community, because it's not just like family, the nuclear family, but it's an extension of people who work together, where, you know, especially now with COVID, where one mom will stay with the kids one day and the other mom will stay with the kids the other day, so that they can you know, each work a little bit to make some type of money. I also think that, you know, we have learned to eat very simple, but very delicious too. Like, I don't think anybody else can make a good bean soups than us, right? So, you know, we've learned how to use the minimum that we have to make things better. A strong faith in God, I think, is also very much key. And really this hope that they have, that the sacrifices that they're making to come to a country where things are so difficult, but they have that hope that, you know, their children will have a better life, a better opportunity, is also something that they hold on to quite a bit. And they've become, you know, very adaptive to crisis and knowing how to manage them. You know, it takes a very strong person to cross the border and to survive it and get through it and continue to live here. You have to become adaptive. I think also for agricultural workers, because their work is so seasonal, even though they make very low wages, they learn how to save, so that, you know, when it's not peak, they're able to still pay their rent. So, but they live very limited. And I think also, you know, they understand the cycles of agriculture, and that's what kind of plays into them being able to kind of foresee what's going to be needed and be able to survive and make it. But COVID right now is making that very, very difficult.
Right, those the supply chain disruptions that you alluded to, restaurants not making those purchases, and farmers deciding, I know we heard the stories this summer of farmers deciding to till their entire crop with, you know, zucchini and tomatoes and all of those things that would have gone to restaurants, to put those back into the ground. And when those tractors run over it, the workers aren't paid. Yeah, the idea that then people would be standing in food lines, who are the hands that pick the food that goes on tables, is really a devastating image.
Yeah.
Thank you so much. I'm wondering, we're in a community in Spartanburg that has put an incredible effort into healthy eating and active living and forming lots of collaborative initiatives. We also have been doing a lot of intentional work around equity. And I wonder for those listening, if you have ideas about what would shape a more just food system, maybe to answer in the big picture first, what sorts of changes and policies should we be advocating for? And what are some other things that are maybe on a near horizon that students and community organizers and healthcare professionals can think about in their maybe smaller spheres of action that could make an impact for farm workers?
Well, I think that labor protection laws, they need to stop being excluded. They should have labor protection laws in place. They should have workers' comp, just like any other industry. Those are basic things that they should have. And I think immigration, there has to be immigration reforms, particularly for agricultural workers. When there's about 3 million agricultural workers and half of them are undocumented, that should, we need immigration reform. It's needed. So I think if we could get those two things, that would greatly improve the working and living conditions of agricultural workers and not keep them so marginalized. I also think that there's been lots of rollbacks right now on EPA rollbacks, and I think that many of those need to be put back in place. I also think that Occupational Safety and Health Agency, OSHA, needs to provide more regulations instead of just guidance to growers about how to protect their workers. Industry will say, well, these are already things that our workers are doing. We're doing it voluntarily. There's no need for regulations. But if that was the case, then we wouldn't have this rate of 35 times more likely to die from heat-related death if those things were already in place. And I think that the other huge barrier is that they should have access to healthcare. Healthcare, I believe, is a human right, but with agricultural workers, more resources need to be put in place for them to have access to healthcare, irrespective of immigration status. They should be able to access a doctor and have well checks and be able to be treated for their chronic conditions that may be a result of all the pesticides and the working conditions that they have. But yet they've been they don't have that for an industry that is considered so essential. I think that we would want to keep them healthy. So those are kind of like big picture things. And more on the horizon, I think that, students have lots of power. There's this this program called the Good Food Purchasing Program. I don't know if you've heard about it. And so, students can ask their schools, not just their universities and colleges, but also public school systems. They buy lots of food. And so if you can get your schools to be a part of the Good Food Purchasing Program, what that does is it creates for a more sustainable environment. And so these are growers that provide fair wages to the workers. They believe in sustainability, animal welfare, nutrition. They value the workforce, the local economy of growers, and environmental sustainability. So I think those are things that you can push for, and also like when you go off into the workforce in corporate America, you can push them also to join these types of programs. You can join also grassroots organizations that advocate for farm workers. I think is very important. For you to educate yourself on the food chain system and and volunteer also like at local clinics that provide healthcare to agricultural workers or immigrants, I think is important. Spread awareness about farm worker issues, talk to your family, to your friends about these issues, and advocate for improved wages and working conditions. Make sure to go out and vote. It's very important. If you haven't done so, try to eat organic, which reduces farm workers' exposure to pesticides and unhealthy chemicals. There's also fair trade certified foods that you can see the labels on food. But you know, those cost a little bit more money than regular food. And so so sometimes it can be hard, but if, you know, you can just, those are things that you if you can do. And if you can't, you know, there's all these other ways to try to help this community that needs as many allies as there are willing to be out there to protect them.
Thank you. Those are lots of ideas. And I wonder if you might also share a success that you have seen happen through maybe connecting research to action or work that you've witnessed at any level of scale, from the individual to a farm to an effort that you've been part of. So something that you've seen that worked. Yeah, so I actually went and did a talk to a church once about agricultural workers and heat, because my and spoke about my dissertation, which was looking at cooling interventions that workers can use while they're working. And so I looked at bandanas, a vest, and interestingly enough, the bandana seemed to work better than the vest. This is a small pilot, right? So nothing significant, but it seemed like the bandana worked much better than the vest. And they cost about $5. And so bringing awareness of this situation to a church that was just interested in what I had done. And they went and donated a whole bunch of bandanas to the Farmworkers Association so they could disperse to the local agricultural workers that you just wear around your neck. You put water on them and then you put it around your neck, and it kind of makes you feel cool because we have such large blood vessels right here. I think that's why they work better than the vest. So that's one somewhat success story. But again, like in research, it takes so much time to finally make an impact. Hopefully it inspires some of the people who are attending to want to join some type of organization. Yeah, no, that's fantastic. And I'm thrilled that you're saying that, because I know we have some of our researchers who've been part of the undergraduate research program. And I know that pace of research is, it's hard. The data collection is hard. And then thinking about drawing the line to impact. I love that you were able to take some of your dissertation work and connect it immediately or pretty quickly to a community that was able to take action and learn through doing that. That's fantastic. We have a little bit of time, and I want to turn to the questions. I know we have a couple there, so I'll ask. I think we talked a little bit about protective factors and particularly the mental health impacts of so many multiple marginalizations. There's a question about the research that you're doing and whether that's directly impacting legislation today. And is there a state or country that has exceptional care acts that we should look to model our policies or legislations after? Is our researcher impacting legislation today? Somewhat. There is this big coalition who's pushing for heat protection standards. And so these organizations have kind of taken lots of research that has been done. Some of our research showing how the heat is affecting workers. And so actually, Senator Kamala Harris introduced this Asunción Heat Protection Act. I'm not sure it's going to pass, but
I think this is the second time it gets introduced in Congress. So there's that going on. And, you know, we just have to continue, you know, putting out the data, giving evidence-based, you know, results and solutions that can work to protect agricultural workers. And as far as you know, a state, well, California is very progressive and has done a lot of work to protect workers. They probably have some of the most progressive policies in place. And country, interestingly enough, I think China does a good job. They actually have heat protection standards in place for outside workers, where they are required to take breaks once temperatures hit a certain threshold, and they're not, they can't work once temperature reaches a certain temperature, they can't work. And if they do work, then the company has to provide them like hazardous pay for working in those type of conditions. So I think they have done, looks like from from what I read, a good job at that.
That's fantastic. We have another question asking that if labs show, that you mentioned earlier, show evidence of things like AKI or other worrisome results, are the workers able to get access or referrals or connections for further treatment, especially the undocumented workers?
Yeah, so the Farmworkers Association of Florida really tries to, they've been there for like 30 years, so they have good connections, and they try to get, when we do a referral, they ensure that the workers get to one of the local clinics, which, you know, usually it'll be low to free clinics, the fee scale for the workers. But, you know, we had this one worker who participated, and the first day we noticed that something was really wrong with his kidneys. And so we had to refer him out, and it turned out that like he actually went to the hospital that day and was admitted and had to go on dialysis. And so a local church was able to also help him to get him to, he was undocumented, to try to get dialysis here in the United States. And that went on for some time, but at some point, all resources had been exhausted, and so he returned back to his country of origin.
Yeah, that's incredible, kind of to have that happen on sort of day one, to see something alarming and then to have to navigate that. And great that there were those who were able to rally around him. I can imagine there are countless other stories that you encounter or hear about as you talk.
Yeah.
Yeah. I wonder if you would like to leave us with maybe an image or a thought that you hold close, something that inspires you to do the work that you do, that might be encouraging to some of those listening.
Yeah, it is actually, I don't know if you know about Dr. Paul Farmer. There's this quote of his that says, you know, thinking that some lives matter less is what is wrong with in the world that we live in. And so I think it's important that we start valuing everybody's life, and we raise awareness of all of the injustices that are happening right around us. We just have to stop, you know, looking away.
That's fantastic.
And for the students to be, hopefully somebody gets inspired to do some research with agricultural workers or the Hispanic population. We need more diversity in research to really kind of get some good results.
That's fantastic. Thank you so much for joining us, and thank you for being part of that research that shapes a different future for so many. I really appreciate you taking the time to join us and to share those stories. And yes, thank you for that quote from Dr. Paul Farmer as well, and for all the good thoughts that you've left us with as well. Thank you.
Happy to be here.
Yeah, thank you to everyone who joined us. We'll let you sign off and be about your evening and also about your advocacy, and go vote if you've not done so already, and go advocate as well for legislation and healthy food systems from labor to table.
Yes.